Hello, veterans. Today we are going to talk about getting a higher rating for your knee. It's my opinion there is no such thing as a 10% rating for a knee. It should be at least two 10% ratings, if not higher. So if you have a 10% rating for a knee, you should really consider filing for a rating increase. The key is using the VA's DBQ form filled out by your doctor, where they measure the correct things and state the correct symptoms that you have. So start out with the first part of the form is diagnoses, easy for your doctor to fill out, get it from your medical record. But the range of motion, this is where we start looking at getting those higher ratings. First of all, right, left knee, they're separated on each side of the form. And what you're looking at is a range of motion, that initial range of motion. All normal or abnormal. You can still get two 10% ratings for your knee, even if your range of motion is normal, if there is pain. We'll show where to fill that out. If it's not normal, and that is you don't have full range of motion, which is considered 140 degrees, your doctor should indicate it. But let's get into the section of the form where you are going to get your higher rating. Here, they go ahead and record in question 3A, this middle part here, flexion endpoint, extension endpoint. Flexion is bending up, extension is bending down. They record the degrees of range of motion. Here's the critical part. If noted on examination which range of motion exhibited pain, flexion, and extension, some VA doctors think you only have pain on your knee in one direction. I find that hard to believe in most cases. Your doctor, if you have pain in both directions, should check flexion and extension. Voila, you have two 10% ratings, one for painful extension, one for painful flexion. That is why I do not believe most veterans should have only one 10% rating. The doctor is supposed to measure passive range of motion. That's when the doctor moves your knee. And then also active range of motion is also measured here on this form. Both should be measured and recorded. Usually won't make that much difference in your overall rating of 10%. Very critical is also 3B, repetitive range of motion. This is where they test after you've been using your knee for a bunch, usually 3-4 times over a period of minutes, where you lift and bend your knee. Could result in a lower range of motion and thus a higher rating. Really critical here is pain, fatigability, weakness, lack of endurance. That is, if over time you have more pain, you begin to experience weakness in the knee, fatigabilities. The doctor should check these boxes. Again, could result in a higher than just that 10% rating you have. Flare-ups, again, do you have flare-ups over time? So that if your knee is fine when you go see the doctor, but when you're at home, the weather changes, like it is today in Colorado, gets cold, you have more symptoms, the doctor should note that in this part of the form. Let's get to another place where you can have more than the 10% rating, and that's when you go down to section 6, joint stability. If you have instability or subluxation of your knee, question 6A, you are talking about another 10% rating. You could have a third 10% rating if you have that instability. And if, question 6D, does the veteran require a prescription? That is, the VA doctor prescribes to you canes, walker, crutches, or braces, and especially the braces. That is a 20% rating for your knee, in addition to the 10% ratings you have for painful flexion and extension. So getting this form filled out correctly is critical to getting a higher 10% rating. I would like to see you get that rating. Please consult with me about getting a higher rating for your knee, and also consult with your doctor and what symptoms you have.